I've read from the Kaiser Family Foundation, they did a poll in July, and they're estimating like as much as 30 to 40% of the nation are saying they're having some problems, and they're using terms like COVID fatigue and stress syndrome and things like that. Can you talk a little bit about like the reality of being home and not having the emotional support or the physical support? I mean, it's what, we're in our 7th month, I think, and I've only seen my grandchildren like maybe 6 times. I still hesitate hugging them.
Yep. Yeah, that's hard.
That's helping with a mother, with some health issues. And I haven't hugged her since all this started because I'm nervous about it. So I know everyone I talk to is expressing the same thing. Like we're sitting here, I'm talking, Chris and Sam are like 50 feet away, putting on their masks, taking them off. I mean, what's the reality of how this is affecting, humanity?
So, COVID-19, as we know, is a pandemic. And, we've never really, in my lifetime, I've seen it happen in other places, but I never really thought it would hit us. I don't, we think we lived in a bubble kind of, thinking that we are kind of exempt from these kinds of, conditions and situations. And what it did was, I think it came in and it in order to try to deal with it, people were finding themselves trying to figure out, how do I deal with it? Never did we ever think we'd have to wear masks, just to go outside and go to the store. That kind of thing is unusual, but it's important. And the feelings of isolation, being, that you were describing, feeling like you're not able to be with your family as often. And that in and of itself creates feelings of anxiety and depression.
And isolation, man, I'll tell you, it's been bad.
And the isolation is really one of the biggest problems. And we'll talk a little later about how that's one of the first things you can do to try to feel better, is to find ways not to be isolated, even while maintaining safety. COVID-19 has caused universal psychosocial impacts across the world. So, it's really amazingly, it's so amazing to think how this has changed the way that we live as a world, let alone a country. So we've seen reactions. People react differently. Remember, every person came to this COVID-19 experience with a whole set of history, information, family life, social issues, psychological issues, whatever the case might be. They came to it with that already in hand. And so we've seen reactions from people like hysteria. We've seen people with economic and financial issues as a result of maybe not being able to go to work because maybe either you were furloughed or your company shut down, or maybe your kids are homeschooling, so you have to be home with them, in doing their care and that type of thing. And so I think that now we have all of that happening, and then add to it a variety of platforms where people are giving information, some accurate, some not accurate, but people are home. So they're watching the news, they're listening to, the media. And so that can actually escalate the anxiety and the sense of isolation.
And I think too, like, we want to criticize the medical community because your husband's an emergency physician. We want to criticize them when they told us one thing in the 1st or 2nd month, and now people have to realize that they're all in a learning environment, and they're trying to be as updated as they can with everything. So when someone I'll just, I don't want to use names, but some, in the big groups, the big organizations, they may have said something in April or May, and now we know in September, based on all the research and the information that they're sharing globally, there's a new way to look at it.
Absolutely. This
And
has been a learning curve for
oh yeah.
everyone. So as the science changes, as they learn more about this, virus, they had to change what to do. And
Mm-hmm.
so the medical community also had to do that. They had to shift and change as more information was
Mm-hmm.
learned and understood about how to, take care of things, how to
Mm-hmm.
diagnose things.
Yeah.
So there's a lot involved, and that in itself caused a lot of anxiety for healthcare providers.
Yeah.
We look at our paramedics, we look at our ER staff, we look at ICU nurses and doctors, those
And
types of,
essential workers, the people that are
absolutely,
making sure we have food and toilet paper and, and
absolutely, yeah,
wipes and whatever else we need on the shelf. I mean,
right,
that's a whole new dimension, for what we've dealt with before, like to make
absolutely,
sure they're safe too. Or like Chris, his real job is at KDKA, going out as a cameraman, videographer, doing whatever, going out to all these scenes. And then we compound it with what we've seen with the protests and the different aspects of that. And, it adds to the fear and the anger. And I have friends for 40 years that you can't talk to right now because there's so much anger, like in their language, and I keep saying we have to go back to like a point of respect. We are all in this together.
Yeah, there's the way I look at it, there's a lot of pain, emotional pain right now in our country. And I think some of the things we're seeing are the side effects of sort of like that years of not dealing with many issues.
Yeah, sure.
And
I
then
agree
add
with
a pandemic where
Mhm.
we're now even more isolated from one another. And all those layers of anxiety. I think you're right. I think that does add to the chaos. It adds to the disruption and the pain that people are experiencing.
I can hear it, like in people. Like I know myself, like the masks are very hard for me because coming from a law enforcement background, the only time anybody wore a mask,
right,
in my world back then, was when they were doing something wrong.
Right.
And I know with the PTSD, the mask is hard for me. It is. And I find myself, like, if I'm in Target or whatever, like I minimize where I go. But if they get too close to me, I have found myself acting like a cop and putting my hand up and saying, please respect social distancing. Right. And they look at me like I'm crazy, and in the community I live in, and we won't say where, I see a couple women, elderly women, with signs on there, one saying that respect social distancing, don't come near her, and the other one saying the masks are all a farce. So we definitely are polarized, and that's not helping emotional issues for all of humanity.